Hello, I'm Natalie Aboulayed.
And I'm Salat Nasrallah.
And today we're going to be talking about the atherosclerosis. Atherosclerosis is a type of atherosclerosis. Atherosclerosis is the hardening of the artery wall by it stops being elastic like it's supposed to be and it becomes hard and thick. Now, atherosclerosis is the hardening of the arteries through it being clogged by fat and cholesterol and more. And this leads to the buildup of plaque, which is called atheroma, which is a sticky substance that hardens the artery wall, and it leads to multiple symptoms which can lead to the patient relapsing. The patient is a female. She came with angina, arrhythmia, and dyspnea. What else?
Also claudication and high blood pressure. The disease begins with artery lining damage, promoting monocytes and T cells to move to the wall and form foam cells that absorbs fats like lipids and cholesterol. These foam cells multiply, and substances like tissue, elastic material, and calcium accumulates, forming an atheroma. The atheroma thickens the artery wall, as we can see here, narrows the lumen, restricts blood flow, and reduces oxygen supply to tissue. It also raises the risk of blood clots, which can block the artery completely, potentially leading to a heart attack. The disease develops due to genetic factor or unhealthy lifestyle choices such as poor diet, lack of exercise, and smoking.
Maybe her symptoms are developing because her arteries are blocked. Because the coronary artery is blocked as well, this can lead to angina, which is chest pain. And she also has dyspnea, which means that she has a shortness of breath, which also indicates that her arteries leading to her lungs are blocked. And arrhythmia is caused by the SA node being damaged because of the blockage.
Claudication is muscle pain, cramping, or fatigue in the legs during physical activity, which is relieved by rest. It is caused by atherosclerosis, where plaque buildup narrows the arteries, reducing oxygen-rich blood to the muscles. Symptoms include pain or discomfort in the calves, thighs, buttocks, or feet during activities like walking, which eases with rest. Also, high blood pressure, hypertension, which is a condition where the force of blood against the artery walls is consistently too high. In atherosclerosis, narrowed and stiffened arteries increase resistance to blood flow, causing the heart to pump harder, which raises the blood pressure and worsens the condition over time.
We used a CT scan, which means that it showed us detailed images of the artery, which showed us that the patient has atherosclerosis. Catheterization is also commonly used. We put it, it's a long tube where we put it into the patient, and then the patient has a dye in the catheter, which helps detect if there is narrowness in the artery.
For the psychological impact, the patient could possibly experience stress and anxiety due to the unpredictability and severity of the symptoms, like chest pain, shortness of breath, or irregular heartbeats, with the fear of worsening health or potential life-threatening events. Depression is also prevalent, as ongoing symptoms and the fear of complications contribute to the feeling of helplessness and low mood. These conditions can lead to reduced quality of life, with patients limiting physical activity and social interactions due to physical limitations and emotional distress.
What could we do to make the patient's case better?
Dietary changes and lifestyle changes. Dietary changes, which includes a heart-healthy diet, like focusing on fruits, vegetables, whole grains, nuts, and proteins like fish, and avoiding processed foods. She can also reduce saturated and trans fat, replacing butter, fatty meats, and processed meats with olive oil, avocados, and nuts. These fats increase LDL cholesterol, leading to plaque buildup in arterial walls. Also, engaging in at least 30 minutes of moderate activity exercise like walking or cycling most days. This is because physical activity improves blood circulation, also reduces LDL cholesterol and increases HDL, which is the good cholesterol. Quit smoking, which is also very important, as smoking damages arterial walls, making them more prone to plaque accumulation and narrowing. Reducing sodium, which limits sodium intake to 1,500 to 2,300 milligram per day to manage blood pressure. High sodium intake increases blood pressure, worsening arterial damage and plaque buildup.
We could also add some medicines, such as cholesterol medicines, such as statins and fibrins, because it will help decrease the unfavorable LDL cholesterol, which also will decrease the atheroma build-up, as well as we can add some beta blockers and also nitroglyceride, because those are vasodilators, as well as aspirin, which thins out the blood, which reduces platelets in the blood, which remove the developing of blood clots. She's not severe yet, but if she needs a surgery, we could use a coronary angioplasty and stent placement, which will open up the blocked arteries, and using a catheter, which will open up the narrowness, and then we can add a stent to keep it open to prevent restenosis. We can also do a coronary artery bypass surgery, which is kind of like a open heart surgery, where we can the blood vessel is used to generate new path for blood to flow instead of the blocked artery. And we can also use an atherectomy, which opens up a blocked artery using also a catheter with a laser or a rotating device to remove the atheroma, and then we use a stent to keep it open.
Factors that interact with atherosclerosis includes the economical factor, which is basically adopting heart-healthy diets, increasing physical activity, and quitting smoking are essential for reducing long-term healthcare costs by preventing the need for expensive treatments. However, implementing these changes requires upfront investment in public health education. Medications like statins and antiplatelets play a crucial role in managing advanced cardiovascular diseases, but their costs might be burdensome. Economic inequality affects access to care, with wealthier individuals being able to afford private health cares, while those with lower income face overcrowded public hospitals and delay in treatments. Atherosclerosis impacts workforce productivity by causing premature death, disability, and early retirement, leading to higher costs for employers. Additionally, families may experience severe financial strain due to the high costs of treatments, particularly when the primary earner is affected. A graph shows a multi-center involving 1,449 participants from across Jordan revealed a high percentage of cardiovascular risk factors nationwide. Key findings includes dyslipidemia, which is 74.6%, obesity 32.5%, smoking 31.5%, hypertension, which is 37.5%, and elevated blood sugar 21.5%. These widespread issues linked to unhealthy lifestyles and chronic conditions highlight the urgent need for public health interventions, promoting better diet, exercise, and smoking cessation. Addressing these challenges is essential to reduce the health and economic burden of cardiovascular diseases in Jordan.
You saying this reminds me that there's a lot of the environmental and social factor as well, because the environment heavily impacts the social factor and how the person's circumstance in life is, such as when the person has a specific diet. For example, there are two scenarios. That one, a person could follow a high sugar, high cholesterol, high sodium, and such diet, which can lead to the increasing of the atheroma in the arteries, which basically diet can impact their life and impact how they go through atherosclerosis. But the other scenario is when the person starts to follow the healthy diet that is prescribed to them, and they lower the sugar, they lower the cholesterol, and they actually increase the HDL cholesterol, which supports endothelial cells, which are the linings of the blood vessels, will stop worsening of the atherosclerosis. And this change in their lifestyle can impact how they develop and how atherosclerosis develops as well. To talk about their life and circumstances, they could also have financial burdens, which can be hard for them to develop such a healthy diet, because it can be a privilege or expensive, as well as it can be they might not have the time because of work, and they will rely on fast food for sustenance instead of creating meals that are healthy for them. Also, environmental surroundings do increase the factor of developing atherosclerosis, because there's a study from the National Ambient Air Quality Standards which show that air pollution prematurely ages the blood vessels, which makes them rigid and not elastic as they should be. Atheroma will build up in the arteries and it will stop being as efficient as it should, which means that the environment's air quality also should help with the patients, as well as their living circumstance. If they live in an environment where people smoke a lot, this means that they are a second-hand smoker, and this can increase the possibility of developing atherosclerosis. And as well as if they live in a healthy environment where no one smokes, that means that they do not develop atheroma. Also, we can see that if the patient undergoes lifestyle changes, also, as you said, that exercise methods should be utilized. But in Jordan, the infrastructure is not really suitable for walking, which can lead to the patients like not being motivated to exercise or to move their body. But we have developed infrastructure such as parks so they can walk. Good afternoon, Dr. Zakaria.
Good afternoon.
Today we're going to ask you some questions for society to be aware of atherosclerosis. What are the procedures used on patients with atherosclerosis, and how is it selected?
Initially, first to say, atherosclerosis is a common disease in Jordan, not only worldwide. In Jordan, it's a common disease. For that, we have multiple procedures. Some of them are invasive, some of them they are non-invasive. The non-invasive procedure is like CT angiogram. It is a CT scan without any intervention. It's only small needle, we keep it in the arm, and we give contrast. Where in our hospital, we have the fastest CT scan can be done within 30 to 60 seconds, and you have the results within 15 minutes that you can know if you have atherosclerosis or no in your artery. The second procedure is the cardiac catheterization, where we are using mostly from the arm. We put also a needle-like catheter, and we do the invasive angiogram, where we can see in reality the arteries if there is stenosis or not.
Okay. In Jordan's condition as a country, is it easy to develop atherosclerosis, or is it adapted to prevent?
No, it is easy to develop atherosclerosis here in Jordan for multi-factors. First of all, diabetic is a common disease, and diabetic is the main issue to have atherosclerosis. Second thing, we have the bad habit of not doing exercise, and as you can see in the daily life, we have a lot of people who's smoking. Smoking is the main issue also that you have rising the numbers of atherosclerosis in Jordan. It's easy to prevent these things. Yes, it is easy if you change the lifestyle and change some of the bad habits.
Can surgery be determined by the patient, or should it be a severe case where you decide?
Surgery, first of all, is decided by physician, by the cardiologist. First of all, he do the procedure like cardiac catheterization, and he look to the anatomy of the arteries. If easy to be done by the cath lab, for example, putting stenting or something, we advise the patient to do it. If we have severe disease, we'll discuss with the patient and the family that surgery can be done. There is some and little number where surgery should be done as emergency cases. If you have a major artery occlusion like left main, then you go to surgery without discussion with the patient or with anyone else from the family member.
Are there cases of atherosclerosis where restenosis occurs even after surgery?
Yes, restenosis is the most common complication, or things can happen even post-surgery or post-stenting. Why? Because if you do the surgery and the patient does not modify his disease like diabetic, hypertension, or he don't quit smoking, yes, restenosis will occur in spite of surgery.
Are lifestyle changes and medications permanent for atherosclerosis patients even after surgery or after being treated?
Yes, this is a good and the best question you ask. Surgery or even stenting does not mean you solve the problem. Yes, you solve the stenosis, but if you don't change your lifestyle, or you don't change the risk factor like diabetic or hypertension, or you are not in proper medication, restenosis will occur. Doesn't mean you do a surgery or you put a stent that you are cured. There is no cure. You should be in medication for life. You should change your lifestyle. And we say that change lifestyle, that means you will do it for life. It's not for temporary. It is a permanent issue. You have to do it forever. Otherwise, your artery will re-stenose again, because atherosclerosis is a continuous disease inside your body.
How often is atherosclerosis diagnosed in Jordan?
It is like the number worldwide. We are not less because we are not more healthy. And diabetic is a common disease like worldwide. For that, the number in Jordan is equal anywhere else. But it is a common disease in Jordan to have atherosclerosis.
Thank you for your time.
You are most welcome anytime.